with our unit. Let me share the screen. Alright, are you able to see the screen now, everybody?
Yes.
Yep. Yes. So now, we were talking about the few of the things that we can do to prevent infection. We have discussed about proper hand hygiene, then appropriate personal protective equipment. We have already discussed what are PPE, things like gloves, aprons, masks, they all come in our PPE, right? Also, safe use and disposal of sharps. Now, what are sharps, everyone? Syringes, needles, all these things are called sharps. Also, routine environmental cleaning. It's very important that where we work or where we live, our surroundings should be clean so that any environmental infections should not spread widely. Now I want to show you how disposal of sharps work and what are sharps. Okay, everyone? Everybody, please turn on your cameras if you can, because I'm not able to see you guys. I'm sharing my screen. Are you able to see the screen?
Yes.
Yep.
Let me know if you can hear, okay? We're learning about disposal of sharps. Yes, we can hear it.
As a caregiver, an important part of your role is to make sure any medical waste in the home of the person you're caring for is safely disposed of. If healthcare waste is not dealt with properly, it can be hazardous to you and anyone else who may come into contact with it after disposal. In this video, we'll teach you how to identify home healthcare waste, identify biohazardous waste, and safely dispose of both and minimize any possible health risks. So what exactly is healthcare waste? Basically, it's any waste that is produced during the physical care of the person you're caring for. This includes disposable gloves, soiled dressings, and incontinence products. For a complete list, take a look at our care guide. To safely dispose of these items at home, double bag them and make sure both bags are tightly closed with a knot or a twist tie. Never put any home healthcare waste in the recycling bin. These items are not recyclable. Certain types of medical waste are considered to be biohazardous and pose a greater risk of injury and infection than regular home healthcare waste. Biohazardous home healthcare waste includes human blood and sharps. Sharps are any item with sharp or pointed edges that can puncture the skin, like needles, syringes, injectors, injection pens, and lancets. Never put any of these items in regular garbage, recycle, or organic bins, and don't flush sharps down the toilet. Always place discarded sharps and human blood waste in an approved biohazard container for safe disposal. You can also get approved containers and disposal advice from your local pharmacist. All approved containers must be labeled with the universal biohazard symbol. Your province or region may offer programs to help you dispose of biohazardous waste like sharps. Programs like the Ontario Sharps Return Program is one such example that provides a safe and easy way to dispose of any sharps you may have in your home. To learn more about sharps and where you can dispose of them, take a look at our care guide. Proper disposal of home healthcare waste is key for keeping both you and the person you're caring for safe. While this video is a good starting point for learning how to save,
BCK Consultants has developed a best practices medical waste disposal process to help ensure the safety of our team and yours. The following steps will provide a seamless disposal process and minimize exposure to employees. Here are the 5 steps to better sharps, biohazard, and pharmaceutical waste management. Step 1. Place sharps in containers inside wall mounts or on countertops and line biohazard waste containers with biohazard bags. Additionally, pharmaceutical waste containers colored white and blue should be placed in a secure location within the immediate area of use. Prior to use, label each sharps container with your facility's name, address, and phone number. Step 2. Immediately after use, segregate the waste into its proper container. Here are the container guidelines. Place the following into sharps containers, which are colored red or translucent red. Hypodermic needles, broken glass from healthcare use, blood vials, any device that has acute ridge corners, edges, or is capable of cutting or piercing, vials with no remaining vaccine, and syringes with needle attached with no remaining vaccine. The following items should be placed into biohazard waste containers lined with a biohazard bag. Highly communicable waste, laboratory waste, fluid, blood, or blood products, and other potentially infectious materials, or OPIMs. These items should be disposed of in pharmaceutical waste containers, which are colored white and blue. Any prescription or over-the-counter human or veterinary drugs, vials with remaining pharmaceuticals, and syringes with remaining pharmaceuticals. Remember, the following are not sharps waste: pharmaceuticals, controlled substances, and chemicals. And the following are pharmaceutical waste: syringes with residual pharmaceuticals, pills and pill bottles, dental ampule, medical vials, unused or expired medications, and supplements or vitamins. Step 3. For sharps containers that are full or ready for disposal, tightly close the lid using the locking tab and tape when available. Place the entire sharps container in an upright position inside of the regulated medical waste or RMW container, ensuring that no needles spill out. For pharmaceutical waste containers, place them next to, not inside of, the regulated medical waste or RMW container to be picked up during your scheduled service day. Keep in mind that it is the generator's responsibility to remove sharps containers and biohazard bags from patient rooms and place them into the medical waste container prior to our arrival on their scheduled service day. Step 4. Continue to repeat this process during your accumulation period and prior to your scheduled service day. Sharps waste must be placed into a sharps container prior to being placed into the medical waste container. Remember, no loose sharps or pharmaceuticals can be placed into this container. Finally, Step 5. On your scheduled service day, perform a 1-for-1 exchange of your on-site medical waste container and deliver any pre-ordered products, sharps containers, biohazard bags, etc. Any waste that does not make it into the medical waste container prior to the scheduled pickup may be placed into the new container for pickup on your next scheduled service day. Following this best practice for your medical waste disposal process will help ensure the safety of our team and yours. To learn more or to contact BCK Consultants, visit us at BCK Consultants.
The last concern
The definition of regulated medical waste, RMW, varies by state. The Regulated Medical Waste Life Cycle. Stericycle provides regulatory expertise throughout the RMW life cycle to help manage the safe and responsible packaging, transportation, treatment, and disposal of medical waste. Step 1. Segregation. Once you generate waste, you must separate waste types based on the guidelines set by Stericycle's Waste Acceptance Policy and any applicable state or local requirements. There are specific containers for biohazardous waste, sharps waste, and trace chemotherapy waste. Step 2. Packaging and labeling. Next, package and label the waste based on the guidelines and requirements set by the Department of Transportation, DOT, and the state you are located in. It is important to ensure all waste bags are properly tied and any boxes containing pathological waste are marked for incineration only. Step 3. Storage. Once you have packaged your waste, store it in your facility until your scheduled pickup. It is important to note that storage requirements for medical waste vary by state. Step 4. Pickup and documentation. At your scheduled pickup time, a Stericycle driver will arrive at your facility, transport the waste to the truck, and provide you with new containers. They will also provide you with the required shipping papers, which you will be asked to sign, and then be given a copy to retain for your records. Step 5. Transportation. The driver safely transports your waste to a Stericycle facility in accordance with DOT and other applicable transportation standards. Step 6. Treatment and disposal. Waste is treated to be rendered non-infectious, typically at an autoclave or incineration facility, and then is disposed of in accordance with federal, state, and local regulations. Biohazardous and sharps waste are autoclaved, while incineration is also used to a lesser extent for certain materials that need to be destroyed, such as pathological wastes and trace chemotherapy. In some states, incineration of regulated medical waste is required. Step 7. Records retention. Waste shipping papers are retained by the generator and Stericycle for the required period to ensure compliance. Records are easily accessible on our customer portal, mystericycle.com. Record retention periods may vary by state. Our holistic approach to healthcare waste management enables us to serve communities across the U.S. Every day, we protect what matters so you can work in a safer environment. Live.
Got it? Disposable of sharps. Now there also, let me show you containers, because I want to give you an idea. For example, this container. In Age Care, if you go, also, I'm not going to play the video, but in Age Care, you will find one of these. You can see this yellow container here. Everybody, can you see this?
Yes.
Yes. In this, basically that. See, now you won't be giving injections and everything to the client, obviously, because you're not compliant to it. But your nurse may ask you to just dispose the sharps. Now, sharps can be razors, shaving razors. You know shaving razors, right? You might dispose them off. So even those sharps will go into this container, yellow container. Okay? Which one do you want to see? Do you want to see this one, Unimedical, or this one? The one which is on the screen. They both are pretty same. Okay, let me show you.
Video on sharp safety. We've introduced these modules as part of our compliance with the Health and Safety Sharp Healthcare Regulations 2013. The aim of these series of modules is to provide you with information on how to use sharp safely, how to dispose of them, and ultimately to give you some advice on specific devices that are in use within NHS 5. This is the first module, which covers assembly and use of sharps bins, and also covers what to do in the event of a sharps incident. There are further videos covering separate devices, which you can view after you've seen this particular video. This is a typical sharps bin. There are various models available obviously throughout the NHS, but they all work in a very similar principle. Key point with assembly is when you're putting the lid on is to make sure the lid is locked in place securely. And a good point of practice is to make sure you press it down at all four corners so that it's properly locked, and then you can check, just give the lid a gentle tug to make sure that it's fixed in place. When you're assembling, please make sure that you complete the assembly label so that we can see where the bin has been assembled and by whom and on which date. Just been filled out with the details of where it's been assembled and by whom. Key points when you're using sharps bins is obviously to use the temporary closure. When the bin is not in use, if it's being transported, then that simply locks in place just with a simple click at the front, and then will be opened when you want to use the bin in practice. We also want to make sure the sharps bins are used as close as possible
to the point of use, and we have this particular system with a tray which is available to allow that to be used at point of use with the patient, and there's somewhere to store your sharps and other bits and pieces before they're used. Key points, obviously, with the sharps bins are the fill line. Sharps bins mustn't be filled beyond that line. When it is full, then we want to make sure that the final closure is put in place, and that's done simply by pushing the lid securely down until it locks into place. Once a bin has been locked and fully closed, make sure that you fill in the closure details and also put on the tag to indicate where the bin has come from, and then dispose of it according to local practices. That's all in terms of sharps bins. In terms of sharps incidents, key point to remember is for you to understand what to do in the event of a sharps injury. You do have a leaflet that is available on the health and safety pages of the NHS 5 intranet, and we encourage you to download and have a read of that. But it does have information as to what to do in the event of a sharps incident. Make sure that you perform appropriate first aid. Keep calm. If your skin is punctured, gently encourage the wound to bleed, but don't suck the wound. Thoroughly wash the wound with soap and water, but don't scrub it. If your eyes or mouth are involved in the incident, irrigate them with cold-based quantities of water, but don't swallow it. Cover the wound with a waterproof dressing. Take a note of where and or of whom the blood or body fluid came, and what exact circumstances you were in when you were exposed. Make sure that you inform your line manager or supervisor that you have had an injury, and then contact the occupational health department or the emergency department as soon as possible after the incident. If you're going to the emergency department, please also make sure that you contact occupational health as soon as possible after any assessment undertaken by ED.
All good? Understood?
Yes.
I'm Alison McMillan.
Everyone? Understood how we dispose of any sharps? So see, as a support worker, you won't be given out like a lot of sharps, but only when when you're giving personal care to the client, when you're just helping them to shower, to do their beard and stuff, or even sometimes some clients just use the eyebrow sharps that we use at home, right? You might be asked just to throw them. You can't just throw them in a regular bin. You have to just throw them in a sharps bin only, this yellow container only. You can't just throw it in that bin. Okay? Understood? Everybody all good?
Good.
Okay, done. Now, the following are infection prevention approaches. First is proper reprocessing of reusable medical equipment and instrument. That means we need to make sure that whatever equipment or instrument that you'll be using on the client or with the client, that should be in a proper usage. You need to check it before. If this is battery operated, you need to check if the battery is working. If it's electrical working, you need to make sure you check before that if it's working or not. Respiratory hygiene and cough etiquette. You must know what's a cough etiquette. Either do it in your palm, cough like that, or put a tissue or a hanky when you're coughing. Don't cough directly on your hand. If you do so, if you don't have a tissue or a hanky, use a hand sanitizer immediately or wash your hands using hand hygiene step. Okay? Proper aesthetic technique. That means using creams on the wound. Proper waste management. Appropriate handling of linen. Linens are your bed sheets. Okay? Linens, your bed sheets. You know, right? Your bed sheets. So now, proper handling of them. Why? Because sometimes if the person has done their bodily fluids on the bed or has wet their bed, you need to make sure that when you're picking up that linen, you should not be just dropping them on the floor, or just dragging them on the floor. No, it's going to create a lot of infection, right? How you should properly handle linen? First of all, use your gloves. Wear gloves, then remove linen from everywhere, even your pillow covers, anything which the person has used. Okay, use that, and then there is a dignified trolley where you put this, or you can put that in a bag, a linen bag, put that, and then take it to a laundry. Okay, you cannot just leave it on the floor, you cannot just throw it. No, it's gonna create more infection. And when all the linens are going to be together, I also don't put the linens together. Don't combine two clients and put their bed sheets together, because that's going to create infection as well. Okay. Now, infection control, everybody. We are going to learn about infection control techniques. These are implemented in order to limit the risk of infection transmission in a workplace or anywhere. These techniques or tactics are known as transmission-based precautions. First of all, application of transmission-based precaution. Second, contact precautions, droplet precautions, or airborne precaution. Now, let's discuss about them one by one. One is application of transmission-based precaution. When we are applying our bandages, or even small, what do you call them, the warm bandages, right, when you put that on the person when they have injury, when we apply them, we have to be cautious enough that we don't leave them on any surface, or any surface where it can be contaminated with infection. Contact precautions, obviously, if somebody is sick, if somebody is having COVID or any flu, they shouldn't be precautious from that person and do not contact them. Third, droplet precautions. If there is any blood or bodily fluid in the form of droplet, you should be precautious about that and should not be transferring from one person to the other. Wear your PPE when you're handling any droplets of blood. Airborne, if somebody, for example, somebody has COVID, they should be isolated so that any of that COVID, should not be getting into air and should not be hindering somebody else or should not be infecting somebody else. So all this precaution needs to be taken for preventing any transmission of infection. Everybody understood? Yep. Now look at the roles and responsibilities that we have. First person is the person conducting business or undertaking any business. What are their roles and responsibility? Their roles would be they usually manage how the workplace is run, correct? Now their responsibility is to plan and implement any risk management strategies. Any strategies that can minimize the risk. The risk can be anything. The risk can be, of infection. The risk can be, anybody coming into workplace and harming others. Any risk. Then responsibility is health and safety of an entire workplace, because they are either manager or supervisor. So it's their responsibility to keep everybody safe. Okay? Now worker. What are roles and responsibilities of a worker? Their role is to perform their work in the workplace. Obviously, their responsibility is to take care of themselves and of others in the workplace. They also have a responsibility to apply by all the health and safety rules. Okay, they also have to cooperate and collab in creating policies and procedures. Sometimes, even managers need help. They also need help in creating policies and procedures. So workers can come into place when when a manager needs help. Then other people at workplace, anybody who's visiting or anybody who's coming once in a while. Now, what are their role? They are just coming for visit. So what are their responsibilities? They have to comply by the organization's policy and procedures. They have to oblige by it. It can be, wearing a proper PPE or staying away from any restricted areas. Okay? It's just visitors. We are talking about visitors here, or friends and family is coming to visit the client. Alright, everybody? Any questions for roles and responsibilities? No?
No.
Now, identify control measures to minimize risk. I think we have done risk management before as well in my class. Risk management. I don't know if you remember, but we have done risk management. So we'll see how much everybody remembers. Okay? Now, what are control measures, everyone? Control measures are the method to reduce or minimize the risk that is present in the workplace. Okay? Now, see, risk can be two types. First would be the likelihood of that risk being coming into action. There's a likelihood that it can happen or cannot happen. Second would be severity. That means it can happen several times, or it has happened several times. Now, likelihood. How can we determine the likelihood? First, how frequently do you perform the task? How frequently are you using that equipment, or are you using that thing that is causing that occurrence? Does performing a task more often increase the chances of harm? For example, we have a violent client. Okay? We have a client who is violent and they don't like to take medication. Correct? Alright? Now, the likelihood of that client to say no to a medication is more likely. Correct? They're going to say, no, I don't want the medication, and they can be abusive. So now in that case, is it likelihood or is it several times this is happening? I can't listen. I can hear you, Jason.
Several times.
Several times, because medication you have to give every day to a client. Correct? You have to give medication every day. Now, has it happened before in a similar or related situation? Yes, obviously that is similar, because you are giving medication to every person every day. But this specific person, because he or she doesn't like to take medication, they can be a little bit abusive, or they can get upset if they will be given medication again and again. Now, I'll show you the chart as well. Now the table first. A means almost certain, that it can happen most of the time. B, likely, that is probably it's going to happen, probably it's not going to happen. Likelihood. Possible, that it could occur at the same time every day. Unlikely means probably not going to occur, not likely. Rare, it's going to occur in exceptional cases. Okay, this is an example of a chart. We don't use it in HCAM. This is just an example. Now, severity of consequences. What kind of harm could occur? Now, what is the impact of the hazard? What factors might influence the severity of potential harm? Now look at the consequences, everybody. First one is insignificant. Second is minor. So insignificant is minor injuries. external reputation not affected, no environmental damage, and threat of litigation. Second, minor sorry, minor casualties that require medical attention off-site, no long-term effects, external reputation minimally affected, minor environmental damage, and single minor litigation. So difference between these two is very clear. Correct? I'm gonna give you a minute to read it so that you can understand yourself. Have a read, everybody. Leo, had you please turn on
Yep.
your cameras. Darwin, Steve. Okay, understood the consequences? Everybody, any questions until now? Ready you? Okay, moving on. Moderate, major, and severe. These are also very easy to understand, so I want you to read it. Do some reading yourself. If you have any question, ask. All good? Question? Okay, now I'm going to ask you guys a question. Everybody, pay attention. Practice in HCAM. Now they have fallen down. Now you guys tell me, which consequences does it come under? From 1st to 5, tell me which consequence does it fall under? The client has fallen down while they were sleeping. Come on, everybody.
Maybe 3.
Minor. I think 2.
I'm 2.
I think minor 2.
Number 2.
And anybody else?
It's moderate. Number 3.
Moderate.
Oh no.
Okay. Anyone else who would like to give? So I've got 2, 3, and what else? Anybody else who thinks it's something else? Okay. It's the first one, guys. Insignificant. I told you earlier, this happens a lot. Falls are very frequent in aged care. So there can be minor injury, external reputation not affected, no environmental damage, and threat to litigation. Most of the time, not even minor injuries. Because you know what? When you get old, you might be even dreaming, or you might lose a sense of where you are, and you might just fall down. And this is very common. Okay? Now, I think you have heard this for the first time, if I'm not wrong. Falls, have you heard it for the first time? Everybody? Falls?
No.
Yes or no?
Haven't heard.
Have you heard, Audrey?
Haven't heard of this.
Never heard of it? Okay. Let me give you an insight on falls. So in aged care, during the night, people do fall from their bed. Now, when they are sleeping in aged care, we put the bed in a low position already. Okay? So when you go on your workplace and right, you will come into, you will see that, everybody say, oh, that person had a fall last night, or Mrs. Johns has a fall. Anything. They will just use the word fall. Like I said already, people might fall down from their beds. Okay, let me show you a video to show you what to do when the person falls down. Let me also tell you, if the person has fallen down, you are a support worker, you're not going to help them. You're going to go in their room, you're going to ask them if they can get up by themselves. You are not going to help them. No. Because what if you tried to help them and they hit their spine or had any more injuries? Okay? We are not going to help if somebody has fallen down from their bed. Understood, everybody? Are you clear?
Yep.
Now, why? Because we might contribute to any injury. Hadiu has fallen down. He's an old person. He has fallen down. Alright? Now, me, I'm his support worker. I'm going to go in Hadiu's room. I'm going to check on him. And I'm going to ask him, hi Hadiu, are you feeling alright? If Hadiu says, yes, I'm alright, I don't know how I fall down. Then, in that case, I am just going to stand in the corner where I am just observing Hadiu. I'm making sure that Hadiu is safe. And then I'm going to instruct Hadiu, Hadiu, could you please try getting up yourself? I'm just going to give instructions to Hadiu. I'm not going to help him. I'm not going to pull him, push him, nothing. If Hadiu says, yes, I think I can get up by myself, it's fine, it happens to me all the time. Then Hadiu can get up. I can just guide Hadiu, oh Hadiu, there's a table behind you, there is your stick behind you, so be careful. I can just tell him by verbally communicating with him. Okay? If, just in case, Hadiu fall down really badly and he's not able to get up, what's going to happen then? I'm going to call the nurse. Nurse is going to come and then we are going to help Hadiu get up. It has to be under supervision of a health professional. We cannot pick up if the person has fallen down. Please get this in your head, lock it. Okay? Because sometimes, we are like, oh, no, I want to help you. No. You might injure the person more. Alright? Understood, everybody? Yeah. So these are the common practices. I'm so sorry you didn't know about this. Now let me show you one video as well. Wait. How do you help? Okay, let me show you fall management. Also, we do help people with falls, like using a hoist or using slide sheets. There's so many equipments that we use in aged care to help, but we don't do it alone. We do it under the supervision of a health professional. I'm saying it time again and again. Don't help it alone. Even if you are in home care, let's say if you are just in home care and there is nobody, then you have to call ambulance. First call your supervisor, then call ambulance. It's that serious. Okay. Alright. Let me share the video with you all.
UNICEF Australia Ambassador.
acid of
Are you
nutrition.
able to hear?
The
So with audio? Yes.
Yeah.
Yes.
situation in Gaza is catastrophic.
See what I said? We are not going to do it ourselves. We are going to call the health professional. We're going to call the RN or whatever nurse is present on the floor. Alright?
Hello, Mr. Farid. Hi. Yeah. Guys, can you just move the leg, please, so we can walk around him, what's happening and assess him? Thank you. Did you hit your head, Mr. Farid?
No, just my left pain.
Okay. Okay, then I'll assess you, okay? I'll check on you. Okay, Mr. Farid, I'm gonna assess you now. Okay? Gonna just check if your arm for me. Is there any pain?
No,
No? What about you?
no, it's
No pain?
no.
Okay. I'm just gonna have a look at your legs. Asada, can you help me please to roll him over? Yes. So, okay. We just wanna assess him. You can roll him over for me. Okay, Mr. Farid. I just wanna check your legs. Okay. Is there any pain in your leg?
No,
What about your knee?
no, it's alright.
It's okay?
Yeah.
Okay. Put this leg down. Okay. Get the other leg. Okay. Is there any pain?
No.
No?
Now this all things, either your manager or a nurse, they will be doing and you'll just be assisting them. Okay? Please understand we are not going to do anything. But it's very important for you to see what's happening when there is fall prevention. Okay? Fall management.
Okay, your knees?
No, it's
No? Okay. That's good. What about your left arm? Okay, very good. Is there any pain? Do you feel any pain?
a little bit.
Little bit?
Yeah.
Okay. I'll put your arm there. Okay. Did you hit your head?
No.
Have a look at your head.
Yeah.
Okay, I think there's a little spot on your head. Have a look at your head.
Yeah.
Is there any pain there?
No.
Oh, I can feel a bump in there. I have to do the neural ops on you, okay? Just gonna lie you back.
Alright.
Just relax.
Okay.
Okay, so back can you put your arm in here, please? Yeah. Okay. We're gonna do the ops for him. Okay. Just, you're gonna do your ops now, Mr. Farid. Okay, so back can we just do his ops?
Yeah.
Okay, hold me there. Okay, put your arm through. Okay. That's good. Try and relax. Okay. You're gonna do your ops.
Alright.
Okay. Now just gonna do your temperature too.
Alright.
Okay, 36.8. If I done your blood pressure is 152/92.
get the doctor in to see you, okay?
Okay.
Okay.
Alright.
Okay, let's do these mirrors.
Alright.
Okay, Farid, close your eyes.
Yeah.
Open your eyes for me.
Alright.
Close your eyes. Open up for me. Good. That's good. Okay, we're gonna call the doctor now. We just take everything off.
Yeah.
And we call Billy. Billy, can you
Yeah.
come and give a hand to us? Can you get the pulsing lifter for us, please?
Alright, Sister Karen.
Thank you. Okay, Mr. Farid is gonna lift you up now. Okay, put you on the bed.
Okay, thank you.
And I'm gonna get the doctor to see you.
Alright.
Okay?
Thank you, Sister.
Okay. You okay? Okay, now let's lift Mr. Farid up. We're gonna roll him towards you, Asata. Okay, because he's good.
Lower part?
Yep.
Alright.
Okay, just be careful. Be careful with his head. Don't run away. Which side? Okay, this side is the sore side. We can roll him over that way. Okay, Mr. Farid. We're gonna help you roll over. 2, 3. Alright, okay. Okay. Okay, Mr. Farid. I'm holding you. We just roll him a little bit. Okay. Here we go. Just relax. Relax. Okay, just relax. We're gonna put you on the bed.
Thank you.
Open the legs, please. Excuse me, Billy. I'll move out of the way.
That's right. Over green and
Yeah, green. Thank you.
okay.
Okay, you lift hand.
Yeah, I think that'll be it. See you.
Grab your hand.
Say one. Are you leaving up? Okay. Try to relax, sorry.
Relax. Watch the leg. Yeah. Push.
Alright, push it down.
Turn the guy down now. Turn, relax. Okay.
Alright.
Thank you. Thanks, guys. Okay. Okay. Okay, hold this up. Hold this up. So, there we go. Try and relax, and I get the doctor. Okay, guys, you guys look after him. Just do these orbs, the temperature half an hourly, and I'm going to get the doctor, okay? Keep eye on him.
Alright, sister.
Thank you. Hello, is Dr. Ellie there, please? Yeah, my name is Irene. I'm ringing from Politician Hill. It's regarding Mr. Farid. Yeah, Dr. Ellie, Mr. Farid had a fall this morning. He was found on the floor. He doesn't know whether he hit his head or not. But can you come and see him, please? Yeah, his temperature is 36.8 and the BP is 152 over 92 and pulse is 80. And he's complaining about his left elbow. He got some pain in there. So you think you can come and see him today? Okay, that will be great. Thank you so much. Thanks, bye. Mr. Farid, Dr. Ellie is here to see you. Okay, Dr. Ali, Mr. Farid had a fall this morning. We don't know whether he hit his head or not, but I did his orbs. His temperature is 36.8 and BP is 152, 92 and pulse is 80. His other people's are okay. I checked him out and I did assessment on him. So he's complaining about left elbow. There's a little bit pain in there. So can you just assess him please and see him, Mr. Farid?
How are you? Okay, I have to check your head. I can see a little lump on your head. So, Irene, I'm gonna continue on the neurons. Nice. Okay, fine. I will check your elbow.
I've got a little bit pain in the elbow. It's
looks like there's a little bruise over there. I will ask Irene to put the ice pack on it. Okay? Irene, please order X-ray.
Okay, thanks, doctor.
With the pain, I will order Panadol, and it's gonna start after 24 hours. Mr. Fari, someone will come and do the X-ray, and I will come tomorrow to see the result. Okay, thank you.
Understood? How fall prevention takes place in an aged care or in residential care? Now, fall risk assessment.
Good day, everyone. My name is Roy. I am one of the falls and risk champions. You have just watched the management of a resident after a fall. Now I will explain to you how to conduct a falls risk assessment to prevent further falls. This is the falls risk assessment form we use in the facility. We have a resident name, date of birth, and the room numbers. The first question is about the time of the falls. When did the resident have their last fall? If it was a year ago, they are scored 2. But if it was in the last 3 months, they are scored 8. The greater the number, the more highest risk they have of fall. The next question is about medications. If the resident is on many medications, they make them drowsy. The score is high, but if they are not on any, the score is low. Lastly, the question is about cognitive function. A PET scale is done to determine this. If the PET scale is high, the risk is high. If low, the risk is low. Then we total all the scores and we look at the keys. The low risk is 5 to 11. Medium risk is 12 to 15. The high risk is 16 to 20. When we know the risk factor of the resident, we inform the team leader, RN, that or if they need an assistive device such as working frames.
Understood? Understood, everybody?
Yes.
Even after fall prevention is done, you still need to write everything on the fall prevention form. So everybody is aware, or even the risk assessment form, so that everybody is aware that this is what happened with, Mr. XYZ, whatever their name is, and this is how we prevented it. Gabriella, you have a question? You raised your hand?
Well, it's not a question. It's like, can you show us if we're working in a home care? The example with the video is working in a aged care facility. How about if we're working in a home care?
Good question.
Thank you.
Okay. Question. Okay, give me a minute. I have videos which are 10 years old, and I don't think that would be, current videos, but let me check. Give me 1 second. Okay, most videos are on residential care, but just give me 1 second. Okay, yep, I found one. Wait. Okay, wait. Alright, are you able to see the screen, everybody?
Yes.
Mayo Clinic emergency departments see patients every day who've been injured by falls.
You can see things as simple as little cuts and bumps and bruises to broken bones to big head injuries where you're bleeding into your brain. There's a variety of injuries that can occur.
Many of those falls happen at home. Here are just a few easy things you can do to prevent them. It starts with reviewing any medications you're taking with your healthcare team.
Every time somebody gets a medication, try to know what the side effects are, especially if they affect your balance or your ability to be awake.
Be informed about any medical conditions that could make you more prone to falls.
Things like diabetes can cause neuropathy where you can't really feel your feet. And then, so if you can't feel your feet and you're walking around, you can't really tell if the surface is uneven.
Other tips inside the house: wear sensible shoes instead of slippery socks, high heels, or flip-flops.
No, they are just giving reason how to prevent.
Stop using ChatGPT and Canva like children's toys. Here's how to use them right.
They are also giving tips that you should wear safe footwear and all that. But see, Gabriella, I don't have a video. Sorry, unfortunately. But if you're in a home care position and you had a client who's fallen down from a bed or from anywhere, firstly, you're going to do the same thing, what you've seen as residential care. Now, the only difference is, in residential care, there is a nurse, there is somebody who is professional, who can help you, but in home care, there is no one to help you. Okay? So in that case, we are going to call your supervisor. If they can send a nurse, well, good, but otherwise, we'll have, in most cases, in my work experience, I had to always call ambulance. They come in, they assess the patient, they help them to get up. Okay, understood? So, sorry, unfortunately there is not a video on it. There should be a video on it, There should be a video on home care. I need to make some videos. I need to get on YouTube. But the same thing. We are just gonna follow the same procedure. We are not gonna touch the client. Alright? Understood? A very good topic, right? I didn't know that you didn't discuss falls yet. But now, understood everybody? Any question? Any questions? Sure? Okay, why do you keep on turning off your video cameras like instantly?
Have you ever had a situation where you're finishing your shift, like about to finish, and then you go home and then your client just like fall down? You stay or you go?
If I am on the shift, because me being a very empathetic person and I have a duty of care toward my client, I will stay. I will stay. I will stay and I will make sure my client is okay. See, in aged care, in residential care, shifts are very frequent. There will be another person coming in really quickly. You just might have to wait for 5 minutes. But if you want to make sure that your client is okay and you feel like, no, I want to stay, I want to make sure that he or she is okay, then you can stay for an hour a bit. You get paid. No, people won't say you don't pay you. Alright. Any other question?
What happened if you at the home care and then she or he forgot? Which number that I should call, and then how much it costs to call ambulance?
Okay. See, all people in Australia they're insured, especially with Medicare. So for them it's gonna be zero most of the time. It depends. And then first of all, if it's home care, we're gonna call the supervisor and team leader. Anybody who is your boss, we are going to report it to them. We're going to verbally report it. And then that person is going to guide you what to do. In most cases, a lot of home care people, they have nurses. They might ring a nurse and they will get to home. Or else in the second position, they will ask you to call ambulance. Ambulance is most visible because ambulance can come fast and they can assess the person, and in ambulance they know how to prevent falls. If the injury is more, they can take the person to hospital immediately. So calling ambulance, but always check with your supervisor. Don't just immediately call ambulance. Yes, in most cases you can immediately call ambulance. That cases are if you see blood. If you see blood coming out of your client, you need to call ambulance. You need to call somebody for help. Okay? In cases where your client is vomiting blood, you need to call ambulance first, then call your supervisor. If you think you hear your clients breaking their bones, if they were walking and they've fallen down and you hear that the bones might have got cracked, in that case, first phone call should be ambulance in home care. We're just talking about home care, okay? We're not talking about residential care right now. In residential care, you have nurse. A nurse can call ambulance or doctor. Okay? Any other question, guys? It's good to ask question to debrief. All good? Alright. So you all have taken off for today. Alright? So you all are having a day off today?
Yeah.
So you study until 10 to 5 and then you take my class as well, 5:30 to 9.
Oh my god.
I didn't know.
It usually finish around 3.
3 o'clock?
Yeah.
Let's see what's happened today. Okay. It's almost 1, isn't it? Yeah. That's why Audrey is like, we always finish at 3. Alright.
Any lunch break maybe?
You need a lunch break now? Oh, I'm so sorry. You know what? Because I live in Perth and I get confused with time a lot. Okay, what's the time right now, guys?
It's nearly 1 for New South Wales.
Oh my goodness, I'm really sorry, guys. Okay, let's go on lunch break. Let's go for half an hour of lunch break and then come back.
But then it started around like 6 a.m. today for us.
Yes.
Okay.
Oh, good. All right. Then it's 12:45 in Eastern times.
Yeah.
Let's go on break, guys. I'm so sorry. You should remind me when you need break. Okay?
Alright.
Yeah, because you guys are starving. I haven't had my breakfast yet, but you guys are starving. I don't want to starve you guys. Okay. Alrighty. Let's go on break and then let's continue. We're not left with much, so it's good.
You have breakfast too.
Okay, thank you.
Sorry?
You have breakfast too.
Yes, I'm gonna eat. Alright, guys. See you in a while.
See.